Welcome to Kadabam's Insights. Today we'll talk about alcohol and problems because of alcohol. Today we have two very interesting aspects of our conversation. One is the topic, and second, the guest himself. About the topic, almost 14 crore Indians, somewhere between 13 to 14 crore Indians have tasted it at least once in their lifetime. This is what our research team tells me. And about 5 crore plus Indians have had problems because of this. For some, this is a party. It reminds them of party. For some, it reminds them of conferences. For some, it reminds them of meeting their friends. For some, it is death, loss of a loved one, health problem, accidents. Yes, today we are going to talk about alcohol from a medical point of view, ethyl alcohol. Welcome, Dr. Madhukar, for today's Kadabam's Insight podcast.
Thank you very much, Dr. Sunil, for that very elaborate introduction.
A person comes to you saying, Doctor, is it okay to take alcohol? Since you see people having problem with alcohol, you've treated hundreds and thousands of them. What could you say? You say it's okay?
No, that's a tricky question. See, when somebody has consulted you as a professional, I don't want any wrong message to go across. Now, how they can see it? The question can be exactly what you said. Or is it okay once in a while, or during birthdays, or during Christmas time, celebrations, anniversaries? The fact is, see, people are educated enough. People have the information. And as professionals, I don't think we can say that it's okay to drink.
Okay.
I think we have to be very, very clear. So, because naturally, they can take it to their families and say, why are you making a big fuss of it? Our own doctor has said it's okay to drink. No, I don't think that is right. We have to look at the health reasons, whether health as in physical, mental health, and the consequences on the financial also. One should not forget that. So it is important not to endorse the use of alcohol. It is clearly, we as professionals, we have to say no. But be mindful of the fact that each one has their own mind.
Alcohol, the usage has gone up, and there could be various reasons, and acceptance level that it's okay to take alcohol has also been probably one of the factors. Now that we agree people are going to take it and it's been part of the culture now, what is your advice as a medical professional, psychiatrist? When can they can start taking alcohol? At least, okay, this is a safer period that you can take, and how frequently they take it, which is okay from a medical standpoint of view.
See, underage drinking naturally should be avoided, is clearly something which...
Underage means, what is the age group that you...
18 and below.
18 and
even in the public places, bars, restaurants, I think they have to check for the age. If I am right, it is 18. Whether they have increased to 21, although there was a proposal very recently. Okay, so as things stand, it is 18 and above. So they are expected to look for proof of age. Okay, which probably many places don't do it. Now, even 18 and above, there they don't need naturally parental consent. If a person has been given the right to vote, the government thinks that the individual is responsible to make a choice, to make a decision based on the rights and wrongs what they are aware of it. Now, where we have to look at is how well educated or how much is the person aware of the consequences. If the family is more liberal, they may make sure that it is part of the family where there is a celebration, and because naturally drink and drive, that also unfortunately we have seen in our own profession where somebody has gone overboard, has excessive drinking, then subsequently got into accidents, and unfortunately even been fatal also. So what one should be aware is about the alcohol plus the, we talked about age and the limits, what is permissible, plus the consequences. Now we all know that once they drink, I talked about the accidents, but also their ability to make any decisions, being impulsive, probably, getting into rash, violent behavior, getting into fights. All these things are there. On a Friday evening, so both of us should take a walk on Brigade Road or be in Koramangala, then we will witness a lot of killers. So that is where I think, although we are not endorsing it, but above 18, one should have the right.
The risk is much lesser.
As long as they are aware of it. It is not a daily, it is not a weekly, it is not a monthly, but special occasions where the families are involved. We can't say no totally, but one should be aware of it.
So, younger age group where the brain is still developing, taking alcohol could be detrimental to their overall development of their brain or their personality. So, we generally see that there are people who take alcohol occasionally, like maybe in the parties or on some special occasion. Otherwise, they're perfectly fine. And there are people who take alcohol regularly, but they're they go on with their life as if nothing has happened, and it's like how we have food. They're taking alcohol maybe daily or weekly, but there are people who have destroyed their life, whom we typically, people call them as alcoholics, that they are day in and out, they are taking. Are there some stages? Are there some grades from a how do you diagnose, and where does the treatment aspect come in?
Why some people it becomes a problem, why it does not, itself is a question. Maybe there are hereditary factors for that also. Somebody who can drink daily, who can probably, as you said, get on with their work with least disruption, and they are able to cope. And that's exactly what we see in a majority of the Western world. But under the circumstances as of now, the Indians' ability to hold drink, perhaps their effect on the liver, their effect on subsequently becoming a dependent or becoming a problem, that is more so in our cultures. Why? Maybe genetic does play a part. Now, as far as when does it become a problem, to your question as such, so you need to go through proper information. That information collection is not just from the individual, from the families also. Because many a times it so happens that the individual may not be aware as to how much he drinks, what he does post the drinking, and how it has affected his, be it studies, if it's a student, or if somebody is working, the effects on their occupational functioning, or their behavior with their family members, including friends. So there are a lot of things which go into that. So that determines actually, it's not just a blood test looking into your liver, because this is where we need to differentiate between what is happening physically. Okay, when we talk about the physical consequences of alcohol, now is it, you naturally take a history whether it is happening once in a while or on a daily basis, plus the effects on the body. There may be, if they don't drink, Or is it their mind is all the time occupied with that, wanting to take the drink? Is it like, when will the evening come? Okay. When am I going to go out with my friends? Does that become a priority? So, at the cost of, we talk about this particular term, salience, okay, of drinking over other activities, which means like all the other activities are pushed to the background. So then you know very well this is becoming a problem as such. So it is not restricted to once in a while, but the mind is thinking about it. That is important. The mind is preoccupied with it, and and it's naturally compromising one's other responsibilities. Then, when you talk about the physical testing, whether there are early changes in the liver, you need to know about the effects on the biochemical markers, which tell you that already the liver is stressed. It is telling you that clearly its functioning is coming down gradually. Plus, now these days you have the ultrasound abdomen where any diagnostic center does it. So there these tests, after a consultation with the doctor, when the doctor looks at it, seeing that it is becoming a medical problem, does a proper investigation, it shows you that there is liver enlargement, fat collection, then the corresponding the parameters are elevated. You are looking at somebody whose already the physical health is being compromised.
We generally, hear from the doctors that this gentleman has harmful use, or he's an abuser of alcohol, and for some people they say he's a dependent user, and people do talk about he's an alcoholic. Okay, what does this terminologies mean, and uh, what is the problem? I mean,
Yeah, I think these are all do have blurred boundaries. Okay, where one
they're not compartments.
very difficult to. So, what we talk about recreational use, we initially, when we referred to celebrations, parties, and events, which could be, once in a while, but the physical health is good, the psychological health is good, then we keep it as recreational use. When we talk about harmful use, what is it which is harmful? The alcohol, which is harmful to what? Both body and mind. Okay, so that is started to affect. When we talk about dependency, where there is a clear sense of craving, the craving where the mind wants it then and there. And in the absence of it, what they go through a withdrawal state. Now, that can be extremely, extremely difficult. It may start with sleep disturbance, it may start with shaking of hands, anxiety, extremes of anger, irritation. Some go to the extent of even complicated withdrawal states. Now, then we know that whether simple or withdrawal state, the person has become dependent. And due to which there is there is a loss of their, maybe income, as in losing job, as family life is affected. All that is much more than what we talk about as in recreational use or harmful use. So this is where you clearly see that the person has become dependent. So when there is dependency, now that forms his life. You talk to him and say, what else you are doing? He will say, look, from morning till night I'm drinking and nothing else to do. So he would have lost his job, he would have lost source of income, he would have lost his family, and probably friends, respect in the society, respect in even in his own community, lots of things which he would have already lost. So that clearly shows that this person, he may have tried. There probably are short periods of staying away, being dry, periods of abstinence, but then relapse. So that also is one more very key feature. So they are able to stay probably for a week or 10 days. Subsequently, they fall again to their own, the uh, interest, motivation, whatever is there would have come down. And alcohol overpowers all that. Okay, so that is like, they have surrendered to the drink and given up everything else. So that is where I think the you talk about as dependency. So you are the rest of it, whether in terms of addiction, all that is varying stages of somebody becoming trapped in that cycle of alcohol use, stopping probably for a few days, going through withdrawal features, then again back into drinking. So, this cycle moving from harmful use to addiction dependence, it in some it may take few days, few weeks, or probably even months. But you know very well they are on their way to becoming dependent.
So alcohol, when it gets into the body, not only acting on one's brain, uh, surprisingly, every part of the every organ in the body, it's
Very, very true.
So if you could just elaborate a little bit on its the problems that it causes to other organs of the body, it would be very helpful.
Right. Okay. So when we talk about the other systems, we talk about gastrointestinal system. In very commonly shown in movies as such, somebody who is drinking, when you have somebody who has been rejected or who has gone through a love failure, they start drinking, coughing up blood.
Yeah.
Okay, so what happens is you have the what we refer to as hematemesis, sudden disruption of these blood supply. But over a period of time, what we refer to as portal hypertension, plus, because of the liver problems as such, you have the portal hypertension or esophageal varices, the veins inside our food pipe,
Okay.
which all get enlarged. Now, there may be sudden cough itself can bring out, or sometimes even with respect to eating something very spicy or choking of food. So that can disrupt these veins and they start bringing out blood, which itself can be life threatening also. Now, that is about the gastrointestinal system. As far as the, again, with respect to the heart, although if you ask the cardiologist or anybody, they will say that, okay, small amount of alcohol improves the functioning of the, maybe a glass of wine, that is what they refer to.
White wine is something
White.
to say.
Okay, so that improves the blood supply to the heart and makes it pump much faster and stronger. But then the mind conveniently forgets the rest of the the advice, which is naturally when you are taking, that starts affecting the system of the heart also. So you have, and most people, we shouldn't forget, they drink but also smoke also. So many a times they both go hand in hand.
Lungs and heart both.
Lungs, heart plus smoking, what it does is blockage of the heart, and then we all know that people can end up with cardiac arrest and sudden death, which can happen. So that's all very, very common. Stroke, we talk about not just the heart, but even in the brain, when there is sudden disruption of the blood supply to the brain, maybe because of the excess fat, and which can get dislodged and which can affect the blood supply. Those are the things which are the major ones. But if I have forgotten anything, you can let us know.
And I've heard of alcohol cardiomyopathies, where
Yes.
the heart muscle becoming weak because of, so it looks alcohol can affect almost all organs of the body.
And memory, that's one more thing. We talk about memory as in when a person has started young, there is a particular term called alcoholic dementia also. So earlier you had that question, what age one should stop as such. But when we look at it, there are people who have had a probably alcohol use 20 years, 30 years, where their memory starts getting disturbed. So that also they are unable to function what is appropriate for that age. So you are looking at their functioning and even their movements also. The kid cerebellar dysfunction, which is well known. So the neuropathies, that's one more thing. The nerves start getting affected. The nerves, a lot of people talk about pins and needles, have difficulty in walking or unable to feel senses in their legs, and maybe they are unaware of the even the falls and what happens, the injuries to the legs also. So that's something which is known to be one of the very common complications because of long-term alcohol use.
This brings to one of the very uh, challenging part of our conversation. Why do people find it hard to stop taking alcohol? What happens? Is it the changes that happen in any of these organs which is getting affected, damaged because of alcohol, or is it in the mind that just I'm not able to control, I just want to take?
I think it is much more than that also. See, the will, as in the individual wanting to stop, may be there, but then there are lots of other things. And reminded, we as a society where alcohol is freely available, but there are some countries, as in due to religious, the Muslim countries or the Arabian countries, where alcohol is not so easily available, okay, or even in some countries banned also.
Right.
So where
Our own country, some of the states where alcohol is banned actually.
I'm not fully, convinced that it is banned, because I've heard that it is available.
Available.
Yeah, probably in a clandestine way, or people cross the borders and get it. So that is there. But in these countries where public use is clearly prohibited, they are able to overcome that. So suppose we have an individual who understands very well that alcohol is, naturally causing problems to his health, and it has already affected him, and he wants to give up. Then what is the support system? That is very, very important too, because the support system where you have a more uh, the understanding, plus who appreciates and supports him in a way not to drink, okay, but there could be other environment where you say it's okay to drink, come along, okay. So the mind is such that you're halfway through, you made your mind. So we talk about different states. You maybe you're contemplating, yes, because I want to give up, but then subsequently, if you are in an environment, it is not available, it is not easily, encouraged, and probably there is a lot more, the inhibitions and restrictions as such. Then the mind has no choice but has to overcome that. But if it is readily available, and if the environment is such that it's okay to drink, and the individual who has given up maybe for a few days or few weeks, then will say it's okay. Also, what is the levels of withdrawal states one has gone through? That also means a lot. If somebody has just experienced simple, withdrawals like just a plain shaking for a few days, or sleep disturbance, and then with a little treatment, he's okay. Maybe he doesn't understand the other more difficult situations some of his own friends or other people would have gone through. So those, the ones who have gone through, who are literally knocked and come back, where they have near death experiences, or people who have gone through severe withdrawal states, they, I think, their determination is much stronger, and understand very well. Their doctors would have told them there is no second chance, and both physical health, psychological health is compromised. They can't choose both, but have to choose one. I think then the options, when it is much less, they are able to decide. Having said all that, in spite of being uh, just we can't consider it as a medical problem, because there are lots of psychological and social reasons to why a person continues to drink, which may be very personal also. If there is a something like a terminal illness, or has lost his spouse, has nobody who is taking care, but is scared of maybe ending his life to other reasons, but sees alcohol as something which is like his companion to keep him going. Well, there are a lot of people who have nothing else to do in life but wake up in the morning, drink, thinking that they can forget their sorrows with the hope that there won't be tomorrow. But when they wake up in the tomorrow, then it is again going to continue. So the determination is individual, but the support system plus the society, how it responds to all that, is equally important.
We spoke about, you beautifully explained to us the harmful use, when you call a particular person to be in that domain of harmful use, and when that person is become dependent. We get into the treatment aspects now. So a patient or a family member of this harmful use person and the dependent use person comes to you, what all would you do, and how, as a patient or as a family, what to expect in terms of the treatment?
Uh, See, again, like physical problems, it's easier. The patient themselves will come to get treated. Many a times, here in our branch as such, the families see it as a big problem. That opinion may not be shared by the patient, or who we call as patient, because he has a problem.
Prabhu.
The problem is in how you see it. In our eyes, in the family's eyes, may be different from the personal. So it's important to hear, to make sure that he is heard also, because that's without gaining that confidence, without being able to, hear from where he is coming from. We shouldn't be jumping, because that will affect the therapeutic relationship. The family may have reasons, but then we have to take a proper detailed history and encourage them to go through a proper health checkup also, because see, physical parameters are much easier to evaluate. See, if you advise somebody to go to a diagnostic center or a hospital to see a physician, get a liver checkup and a whole body checkup, they are much more open to that idea. If you say you have to stop drinking, you are not going to function like a family member. Okay, because you still have to be a professional. You are a professional. You have to balance both the family side as well as the patient. So one, responding to the physical problems to start with, to understand, to listen where they stand as far as with respect to alcohol is. And most of the times they don't accept, they don't think it is a problem. And only when there is some physical, the findings, then probably they'll open their eyes to the reality that it has started to work. The alcohol has started to work on their systems. So I think to start with, both listening, getting the information, understanding, and also perhaps it's the family who have tried several times, who have advised the patient and want you just to advise the patient. It doesn't work. So we have to evaluate properly for their effects on the physical plus also the psychological. So when we talk about psychological effects, yes, talking to them alone, going through some psychological testing, their occupational functioning, their systems, plus many of them may not talk about it, but sexual dysfunction also is something very well known, which naturally, consequence of it is anger, irritation, frustration in life, and which may reflect in other areas of one's life. So it's important to get that information and then be able to talk with these findings. I don't subscribe to that view that the minute family says that there is a problem, we go and bring the person and treat him forcibly, because we have to understand, if somebody is less than 18 is different. Over the age of 18 and above, you need their cooperation. Okay, so that is where the Western world is, that the families actually have no role there. So it is about the individual making those choices. But the choice has to be based on the information and the proper assessment. Now, in spite of all the tests and your recommendations, and where you feel that it has already started to compromise his health, physical, psychological, the individual may still, get up from his chair and say, "Look, it's my life. Why are you advising me? Why are you interfering? Then I'll go and drink, okay, and to teach a lesson to the family or anybody, and that is possible. See, these days, every street probably has about 8 or 10, outlets which encourage you to. So, but the motivation may be there, may not be there, but you have to work on that motivation. Okay, so you have to work on that motivation, which also means the families and the patient, and including the professional, has to have patience. See, for it to become a problem, it didn't happen overnight. Is that right?
Yep.
So, for it to become a solution or as in a treatment option, also, all of us will be required to take that hard
Journey.
yeah, hard yards you have to put in. You have to work towards that. So that part of it, that patience has to be there in all the the factors which are there, whether it is the psychologist or the family therapist, anybody, because it's not like treating like a cough and cold. 5 days of medicines, and you have a paracetamol or whatever, and the throat is relieved of the congestion, and
That's exactly that's
can move on. But this field doesn't work like that.
that's exactly what I was coming to. When you're talking about treatments, what are the different treatment settings that is necessary? Uh, a person with fever, I can go to a hospital, get checkup done, and take medicines and come back and stay at home. But severe infection, yes, I have to get admitted. But here, when can I, have just a treatment outside and, consult you and, you give me medicines and I'm fine? Or when should I get admitted to your institution or the hospitals? Or I also hear about this de-addiction centers, the programs. What is the journey being in a hospital setting?
Correct. In a hospital setting, where it is much more protective and he feels safer. We shouldn't forget that stopping alcohol can, we talked about it, it can bring back that anxiety, severe anxieties, and even going through depression. So once the removal of that alcohol, naturally the concentration starts coming down, and it can cause a lot of psychological disturbances. When it comes to the more severe, as in the de-addiction centers we talked about, it's worth understanding if an individual has gone through outpatient consultations but not been successful for various reasons, gone through hospitalization for a week or 10 days, whatever, and then gone back and relapsed, or somebody who has been drinking for days together, leading to severe physical complications or psychological complications, as in psychotic states we talked about it, where a person is danger to himself, to others, all that, which naturally will need an initial phase to stabilize. But you also need him to be in an environment where he needs to be away from the drink for substantial period of time. Now, when we talk about de-addiction centers and rehabilitation work, it is not about medicine. See, medicine will go on, but it is more to understand there is life without alcohol, which probably they would have forgotten, and there is also a healthier way of living. So maybe even reading newspaper they might have forgotten, doing simple physical activities, playing with other people, okay, and maybe attending some groups and all that. Important to understand, not everybody has to go through that pain what the other one has gone through. So hearing, listening, seeing somebody else also is enough to open the eyes. We ourselves have to have a more positive mindset when we talk about rehabilitation, because getting addicted, getting habituated, the brain is much quicker. Okay, the brain chemistry is such that the brain adapts to that much, much faster. In fact, there are certain drugs, even once they take it, the brain chemistry is altered for life.
Oh.
Okay, so then they can't, be without it. And even if they have already, if nothing is available also, they would have already gone into deep disturbances. So the brain changes what has happened for it to revert, for it to go back to, they reverse to a certain level of earlier functioning, you need time. Now, that time staying at home means not doing anything. Now, that means the person is again boredom. He'll complain of boredom. What to do? Because nothing else, the recreation is all alcohol. So, to avoid that, to help him overcome that boredom, to bring back that activities, to bring back his own natural resources and be able to contribute to the society. See, when a person is drinking, he, especially when he has got into deeper levels of absent dependence, he doesn't care about anything else for the feelings of others also. So, what is happening, how the family members are suffering, what is their health, whether they are studying properly or not, if they have children. So, lots of things, the sensitivity, everything would have gone. But then, being in a group, being in an environment which makes them get back their true feelings, feelings for others, being able to get back their employability. So one should not get demotivated or feeling that they have done enough and there is nothing more.
It's quite reassuring that there are different levels of care that is available, different settings that is available for the different problems that individuals go through because of alcohol problem. You mentioned briefly about involvement of clinical psychologists and family therapists. Uh, can you just briefly talk about who are all the professionals who are involved and what do they do?
You have the psychiatrists who are mainly with respect to looking into their psychiatric illness, medical health problems, proper diagnosis, management of their withdrawal states, other conditions associated, anxiety, depression, whatever, which needs medical intervention. Plus, there is a need for any anti craving that also is looked into by the psychiatrists. You have the nurses who monitor on a regular basis, who work. We shouldn't forget the nurses because they are the ones who spend a lot of time with the patients or the residents, whoever you call. So they are there to encourage, give them the confidence, motivate them. You have the clinical psychologists who are, naturally the skilled people to do a proper assessment. How the mind works, what does it do, what personality characteristics they have, do they have underlying, again, severe psychiatric problems? All that assessments are done by the clinical psychologists who either have an MPhil or I think it's a master's in clinical psychology. They can do that, and they are working with the individual to what is, somebody's mind on the balance, to drink, not drink, to give up, continue, all this, how to improve their motivation. So basically working on their motivational interviewing, plus improving they do different types of therapies, individual therapy, cognitive behavior therapy, because the mind thinks differently. It may be easy in some, not so easy with others. There may be a lot of resistance, assumptions, whatever you call, which probably are faulty, which are resulting in their behavior. So they have to work on their thinking, they have to work on their behavior, and these are all time consuming. And working on specific aspects of their personality, how to improve the trust in others, how to improve their self confidence, because many a times their self esteem is severely affected. The person may feel, he is no good. The society thinks he is no good. So many they would have given up. So you are working on all these areas to improve their confidence, to improve their ability, as much as to how they were earlier. So that takes a lot of work and effort by the clinical psychologists. When you have the psychiatric social workers who look into the influences, the social influences on their habits, which have continued, plus look at the families, their concerns, how it has affected their family, plus working together with them. So not only the families, with the individuals, and where many times the families, because of being scared or never had an opportunity to put across their points of view. So they facilitate the discussion between the patients and the families, and they are an integral part of the treatment team. So the families are supported, encouraged, given that confidence, education part of it, so that they are better equipped to understand what to expect, what not to, and how to continue to be there for the family, for the patient. So these are the three main professionals. And of course, when somebody uh, gets discharged, goes back into the community, so you do have that follow up also, which can be done by the phone, which can be done by home visit team in case of the individual is unable to come. So overall, it's a comprehensive assessment, treatment, plus the management which goes on.
One last, but the most important part of the information that is needed, what are the medicines? Are there medicines available for these people to quit alcohol?
Yeah.
What are those medicines?
See, medications definitely are available. It is used, but not used in isolations. We should use in isolation with the other psychological and social treatments. However, in some, naturally, because of their time constraint or their lack of belief in the uh, other systems, as in psychological and social, medicine gains prominence. So, when we talk about medicines itself, you have one to take care of the withdrawal state, which we short term use
That is when they stop taking.
as a substitution. You are right. When they stop and you that unpleasant when features, what unpleasant problems what they go through to tide over that anxiety, sleep disturbance, they are used for a short while under medical supervision, and that can be stopped after a few days. The ones which we talk about as anti-craving, now that they are available. Before the anti-craving, we also had the deterrents, which means you take a tablet, they commonly prescribe disulfiram, where the fear is if you drink, the effects of the interaction between alcohol and the disulfiram medicine. Yeah. Okay. So that can be extreme cause of discomfort, and which can be in some cases, rare cases of even being extremely dangerous and life threatening. But the fact is that you are taking the tablet, you know very well you should not drink. So that is a good enough deterrent. Again, I refer to that term because it tells you that you are taking the tablets, don't drink, because you are reminded of the dangerous problems which can cause interaction of alcohol. But it has no role as far as the craving is concerned. So that has been in use for several decades now. It remains in use, which a lot of clinicians are comfortable. The more probably in the last 2 or 3 decades, it is the shift is towards the anti-craving. So you think a particular medicine will reduce the craving. Yes, they all have their own the limitations. Maybe 40%, 50% of them are effective. Many of them may not be. So you have your acamprosate, you have your naltrexone, you have baclofen, then you have topiramate, all these things. There are others also, which will, when you taken on a consistent period, over a period of time, it doesn't work immediately, but over a period of time, 3 months, 4 months, they make that the individual much stronger. They improves their determination, and more importantly, in case they drink also, the effects are not dangerous like in say disulfiram. And the other thing is about their the liking. So what you get when you had alcohol, whether the lifting of mood, that euphoria, what you expect, that won't be there. So then when that isn't there, what's the point in drinking? So it is more to reducing the effects of alcohol plus reducing the craving. So they are effective, but I do believe that one should not be focusing only on that, which is good to have it, but you have to work on their motivation levels. You have to learn to say no under particular circumstance. If it is like one is taking, say, acamprosate or whatever, and you meet friends of 10 people, all of them are drinking. So, and all of them say, "Come on, join us for a drink." So, your acamprosate is not going to prevent you. Okay, one has to understand the individual also has to put in their effort. So, this understanding the concept and focusing on their own willpower, determination is important rather than just relying on medication.
So wonderful talking to you, Dr. Madhukar, and I hope this will be helpful for the people watching Kadabam's Insights. Thank you.
Thank you, Dr. Sunil, for the opportunity. Just one last sentence. One, alcohol as a problem has existed and will continue to exist. And in fact, it is seen as the biggest revenue for the government. So when the society, government continues to encourage, we are working with against all these forces also. Okay, so we have to be mindful of our own limitations, plus continue to work positively, because that one individual who comes to us probably is genuine, wants to give up, so we shouldn't lose that. So we should continue to work.
Thank you so much.
Thank you.
Thank you.